Imagine a groundbreaking effort in medical research that could significantly improve the lives of countless newborns suffering from mysterious illnesses. But here's where it gets controversial. Despite advancements, questions remain about the speed and accessibility of such genetic testing programs. This is exactly what Japan is stepping up to address. The Japan Agency for Medical Research and Development, AMED, is planning an ambitious expansion of its genetic analysis program specifically designed for infants hospitalized with severe, unexplained illnesses. This initiative aims to refine the process of diagnosing these mysterious conditions by increasing the capacity for genetic testing and making the whole experience more family-friendly. Starting this fiscal year, the program will double the number of genetic analysis facilities, moving from a single base to 2, and extend the number of clinics where specialists consult directly with parents from just 2 to 5 across the country. AMED's goal is straightforward: to facilitate faster, more accurate diagnoses and ensure that newborns anywhere in Japan can access prompt, effective treatment. Currently, around 10% of babies in neonatal intensive care units face illnesses with no clear cause, often complicating treatment decisions. To uncover the genetic roots of these conditions, tiny blood samples are collected from the infants, carefully and with minimized pain, and then analyzed to detect mutations that could explain their symptoms. Once the genetic data is reviewed, neonatal health professionals and specialists use the results to guide diagnosis and treatment. Since the program's inception in 2019, it has involved 136 hospitals across 45 prefectures, including Tokyo. By February 2025, over 500 infants had been screened, with more than half, 255 babies, receiving diagnoses based on their genetic profiles. An illustrative example: a baby initially thought to have a liver disease was later diagnosed with leukemia, thanks to the genetic analysis. The process typically takes about a month for one genome test, but with the establishment of 2 analysis centers, one in eastern Japan and one in the West, AMED hopes to streamline this timeline and safeguard data against possible disasters. Currently, Keio University Hospital is the only facility conducting such genome analysis, but plans are underway to add Okayama University Hospital to this network within the year. Additionally, the number of consultative centers where parents can discuss their child's results, initially just at Keio and Okayama, is set to increase from 2 to 5. Looking forward, AMED aims to roll out these upgraded features as early as 2026, including setting up online platforms where parents can receive explanations remotely. However, accessing comprehensive genetic counseling remains challenging, as only about half of hospitals nationwide employ both neonatal care and genetic specialists full-time. When a hospital lacks such experts, the cases are managed through consultative centers, which sometimes complicate scheduling and require parents to travel long distances for meetings. Toshiki Takeuchi, a pediatric neurology specialist involved in the program at Okayama University, emphasizes that expanding the number of analysis bases and consultation centers will help create smoother pathways for diagnosis and treatment, ultimately improving outcomes for vulnerable newborns. But this raises an important question: how will the balance between centralized expertise and regional access evolve? And who will ensure that all infants, regardless of their location, receive timely and accurate diagnoses?